Did you ever take a selfie and thought, that's my chin? As it turns out, our selfie obsession is leading more and more of us to get plastic surgery and injectables and all kinds of things done to fix that thing.
Fix the problems. Joining us on the Kogo News Live line is board-certified cosmetic dermatologist Dr. Kimberly Butterwick with Cosmetic Laser Dermatology of San Diego. Doctor, good morning. And have you actually seen more patients because of selfies?
Well, I think so. Selfies, unfortunately, sometimes exaggerate or emphasize our flaws, make us aware of things we didn't know about, particularly the saggy neck and jawline. And so patients will come in and say, I didn't know I had that until I saw that picture. And so, yes, I do see that, especially with our increasing trend in our country to share our photos, have our photos out in Facebook and everywhere else. So if you have a bad photo, it reverberates to all your friends, unfortunately.
And how many people, they see that selfie and they go, oh, well, there's Grandma's chin.
Exactly. And they weren't aware of it. It's particularly the lower face. And, one trick is never take a selfie from below your face because that really makes you look bad. Just hold a selfie above your head and you'd be much happier with your photo.
Well, that is very true. That's one of the tricks is to take a photo up high because it makes you look thinner.
I've never done that.
Oh, you have. But a lot of people also, they're saying their noses look bigger. And is that because the picture is so close up?
Well, yes. I mean, you take an arm's length photo, and it's a wide angle, so it does make your nose look much bigger and your face sort of look narrow. So it's not the right proportion that is actually seen in person. But it does make you more aware of your flaw, and there are many things we can do now that are simple that can improve the look so easily. So that's why I think more and more people are coming in for natural, non-invasive treatments.
Dr. Kimberly Butterwick with Cosmetic Laser Dermatology of San Diego, and the selfie craze that has sent more of us running to her office screaming. Have you ever had somebody come in and you look at their face and you think, there's nothing that needs to be done here? How do you deal with that patient?
Well, there's usually some little thing we can get, even if it's just unclogging a pore or helping that patient. Some patients do become overly self-obsessed, and they want to look like a movie star that's really not possible. So we try to be realistic and generally break the news that they can't look as perfect as the Kardashians. But I think most people now realize that the Kardashians are sort of an ideal that isn't really obtainable. We don't have to look perfect. So I don't see a lot of patients that are just overly obsessed with perfection. Most people just want to look as good as they feel on the inside. So natural correction and natural beauty is really what's the trend right now.
Well, I was going to ask, is it mainly women or is it some men as well?
Well, men, too, come in, and they do not like that saggy neck and jawline. Or maybe they are unaware of the big frown line between their eyes until they see it on a selfie. And so, yes, we do see more and more men coming in now, too. Although half the time they're sent by their girlfriends or wives. So sometimes they need a little nudge to come in.
That's mean. Good Lord.
Well, if you get a correction, if the woman does, then she wants her spouse or her boyfriend to look as good as she does.
Ted, you should look as good as me.
I'm
saying.
working on it.
I'm just saying. Now, when you say non-invasive, I wanted to go back to that because, a lot of people think you've got to have this massive plastic surgery to look better, and you don't anymore, do you?
No, you sure don't. One thing that really helps is getting fillers in your cheeks because when you take a photograph, the light bounces off and looks so much better if we make the cheeks symmetric and beautiful. And the other thing now, and we can do that with a simple filler, a little Botox between the eyes for the frown line. And for the neck, the saggy neck, there are nice non-invasive treatments, ultrasound, something called ThermiRF. And just FDA approved this week is a new treatment that'll be just an injectable for the double chin.
Wow.
And that's called Kybella, and that will be available very soon.
Well, that's a good thing that Dr. Butterwick, I am on my way to your office as we speak. Thank you so much, Dr. Kimberly Butterwick, board-certified cosmetic dermatologist with Cosmetic Laser Dermatology of San Diego.
Yeah, and so many of us are looking at pictures going, wait a minute, I'm not that old yet.
How did I get to look like that?
Happened to my
exactly.
eyes.
You can do something about it.
Yeah, you can.